The Minister of Health, Honorable Kwabena Mintah Akandoh, has expressed disappointment over the poor execution of a $100 million contract awarded to Lightwaves to connect 950 health facilities across the country. Speaking today during the Government Accountability Series at the Presidency, the Minister revealed that the project, which began in 2019, was expected to be completed by 2022 but had to be extended twice, first to 2023 and later to December 31st, 2024, due to delays in implementation. The $100 million project was aimed at strengthening the health sector's digital infrastructure by linking hospitals, clinics, and health centers to improve communication, data sharing, and service delivery. Mr. Akandoh explained that the contract was structured into three milestones, each requiring the company to hand over completed portions of the work to the state upon completion. Mr. Akandoh reiterated the government's commitment to enhancing healthcare delivery through technology, but warned that future contracts will be closely monitored to avoid similar setbacks.
In 2019, Ghana government signed a contract with a company called Lightwaves. And the contract sum was $100 million to connect 950 health facilities. The contract was supposed to expire in 2022. At the end of 2022, the contract was not well executed. And if I say not well executed, he had not connected the 950 facilities. And therefore, the contract was extended twice to expire in December 2024. At the end of the expiration, out of the 950 facilities, only 450 facilities had been connected. At this point, you'd all agree with me that the contract was meant for 3 years and extended for 5 years for 950 facilities, and you have only delivered 450 facilities. Clearly, nobody needs to tell you that the company underperformed. And so when we took over as part of the contract, they were supposed to hand over whatever they executed to the state. So the contract was divided into what we call milestones. Milestone 1, milestone 2, milestone 3. So at the end of each milestone, they are supposed to hand over to the state.
The minister revealed that as of December 31st, 2024, the vendor had received about $77 million, representing more than 70% of the total contract sum, although less than half of the work had been completed.
I have stated that the contract sum was $100 million. At the end of 31st December 2024, although 450 out of the 950 had been connected, the vendor had been paid about $77 million. Clearly, more than 70% of the total amount had been paid, and less than 50% of the work has been done. At that point, we had to refer everything to the AG and the appropriate quarters, including the security, for advice and appropriate action. As a ministry, what we had to concern ourselves with was a solution of the matter to get out this mess. In order to avoid these disruptions and the shutdowns we are experiencing, although we didn't have any contract with the vendor as at the time we took over, we indicated to the vendor that the ministry was ready to sign service maintenance agreement covering the 450 health facilities. Don't forget that the software is and was not for the state. That is why it's called LIMS, Light Wave Health Information Management System.